should I fire my doctor, is actually all about me. When I started pursuing wellness, it just wasn't to help the many patients I was seeing as a practicing physician, or to help healthcare providers, medical students, and others as my role as a medical professor, or for the business and organizations I was speaking to throughout the country on health issues. I wanted to be healthier and happier because I wasn't satisfied with my own life, because I knew that there were some things missing. It's not that I was leading a totally unhealthy life, but just something was missing. And I really had to answer the question, what is healthy? So I decided to pursue this just like I've pursued other areas of my medical profession as a researcher and a medical school professor. I wanted to take a topic and try to answer the question of whatever I was trying to study. And for this topic, it was, what is healthy? I wanted to know what makes people unhealthy and unhappy, and what makes them healthy and happy, and what can we do about it? What does the data show? So I started reviewing the world's literature on wellness, and I started attending medical conferences, wellness conferences, and I started reading books by respected authors on wellness. And then I started conducting wellness conferences and applying a lot of these concepts and talking about them at my wellness conferences. But more importantly, I started applying these essential elements to health and happiness in my own life. And I started to see the results. And I realized most of us rely on our healthcare providers to be healthy, when in reality, it's up to us. We need to work on our health. And health is not found in our doctor's offices. It's found in our lifestyle. And yes, we need a healthcare provider to order the test and lab studies that we need and to look for disease. But it's actually up to us to try to prevent most of those diseases, because it's a fact. All diseases can be prevented or greatly improved with a healthy lifestyle. If I'm diagnosed with a major illness tomorrow, or if I have an unfortunate life expected event that may occur in my family, I'm going to be able to tackle that a lot better if I'm physically, emotionally, and spiritually healthy. It's going to be better for me, and it's going to be better for my family and everyone. And that's what Living Well Aware is all about. It's about us taking care of ourselves and trying to reduce a lot of the self-induced disease that we're seeing today. And in fact, of that 2.5 million deaths that occur in the United States every year, hundreds of thousands of them are totally preventable with our lifestyle. What we have today is a culture war. Our culture has given us unhealthy food, has given us a sedentary lifestyle, has increased our chance of having substance abuse, from smoking, alcohol, to use of other drugs. And our culture is also stressing us out. And these emotional problems are leading to a lot of death and disease and depression. And so what we need to do is look at our own lives, and what I think is apply what I call the 11 essential elements to health and happiness. And by applying these, we can decrease a lot of this self-induced disease and get on a road to health and happiness.